I see my patients 3 times a week, sometimes even more than their families. My name is Hong Yan, the Deputy Nurse Manager. I started my nursing since 1998. As a dialysis nurse since 2010, until now almost 15 years. Hello, good afternoon. 弟妹你来了，今天来得蛮早的，我看看你的体温啊。My day begins with greeting patients and reviewing their fluid removal condition, particularly for those patients who frequently experience intradialysis hypotension and cramps. OK， 来量体重。你每次都是穿鞋子的哈？OK。50.20. Every session patient come in, patient will take their weights, do the monitoring BP, make sure BP is stable. 来坐好啊。现在量血压哈。OK 好。有没有头晕呢？
没有。
哦。有没有头痛？
没有。
OK， 都很好啦。I know Madam Teng since 2012. Actually, at first day we meet each other, we are like friends already. Talk our life, how many children, and how many years you are be dialysis. Then she also asked me how many years be nurses. She also said, "Hey, first time I see you, feel very close to each other." 现在这边的血压挺好的，130好。来，我们站起来哈，量站的血压。来，你这个东西我帮你一下。来，你坐到里面去。
我第一次见到红艳，就觉得她很亲切，看起来她开心的样子，好像给我们病人很开心一样，所以我见到她我就很高兴哦。
哦，那天你老公还在跟我说要煮给你吃啊，煮给你炸鸡翅哎。
好像有时我跟他说我不舒服啊，就我说有时抽筋啊什么，他们快点帮我按脚啊什么，不然就我人不舒服就去。跟我打电话去 ambulance 去医院哦，有照顾我们就对了啦。我很安心，这样没有说好像害怕什么。
Patients with the dialysis often experience feeling of isolation and anxiety due to the frequency of treatment and lifestyle change required. I'm very mindful of their hurdles, and so I make a priority to attend them and take a few minutes to talk and ask them how they are feeling. Beyond the clinical question, this approach can help make them feel supported and heard and build a rapport and trust with them. 中间有不舒服啊，或者抽筋啊、头晕啊，要跟我们讲哈，不要等到已经很严重的再讲啊。If patient feel unwell during dialysis, we'll immediately to attend patient. How are you feeling? Then she said, I feel the cramp. Or feel the giddiness. If like that, we'll pause the fluid removal so that patient can be better after a few minutes.
我们洗肾的人身体很难讲的，有时候突然间抽筋啊什么，有一次就是抽筋到整个人细菌感染，他们马上给我打电话去送我进医院了。我想对红艳说，我当然是妹妹，我很感激她，很感恩。他对我很好。
Working as a dialysis completely changed how I view life and health. You see, with our daily life, actually we feel very easy. Maybe we just normal work, just can run, can do whatever we can. If one day our leg got problem, or even stand up also got problem, so never happen to our body. Actually, we never cannot imagine how hard is it. It's the same as dialysis patient. 邓弟妹好了哈，来我带你出去哈。
OK， 谢谢。
来，有没有晕？
没有。
有晕要跟我讲哈。
好。
啊，慢慢走。家里如果有抽筋啊或者不舒服啊，你最好坐下来或者躺住哈。好了，你老婆好了哈。OK， 好 ，Take care 哈。OK， OK， 拜拜。有个好老公啊，把你照顾得这么好。Dialysis nurses often form strong bond with patients, so make it harder when patients' health decline or when they pass away.
妈，
文馨你来啦 ！OK， 这是妈妈这姑娘来。
我饿了，妈妈。
你饿了，那我们等会去吃，要吃什么？
What I think my mother does at work, right? On the first talk about kidney dialysis is that she will like poke needles into the patient's vein, and then the blood will come out and go into a machine, and the machine will cleanse all the waste materials out. Her uniform can get quite dirty sometimes. Because sometimes when she like poke the needle, right, like the blood will like split out onto her uniform. How I got to know that was because when I was young, she came back home, I wanted to hug her and she was like, no, there's a lot of blood. And I'm like, fine.
One of the biggest misconceptions of dialysis nursing, people will think it's repetitive and just hook patient up to a machine. But in reality, it's a highly specialized field and quick clinical judgment and deep understanding about fluid balance, electrolytes, and individualized patient care plan. Another misconception is that many people think dialysis nursing isn't as critical or fast-paced as ICU or ER nursing. But the truth is we are dealing with life-threatening hypotension, arrhythmias, and electrolyte imbalance, often with little warning.
Okay, so I think my mother is like a very hardworking person. Something she does, right, she does it to the maximum. For me, she's like a role model to me. Right now I'm JC2 and I'm like, my A-levels are coming up and I'm very overwhelmed to study. So like seeing how she managed to push through in her hard days makes me want to do it the same thing also.
The most rewarding part of my job is the meaningful connection that I build with patients. Patients come to our center 3 times a week and hence become a consistent part of their lives. It means a lot to me when they feel comfortable, supported, or even happier just because I'm there. Knowing that my presence can make a difference in their lives is really very rewarding.
I think that the patient sees my mother as someone cheerful, always willing to talk to them. But then the side that I see is just her tired self and how like maybe there are times like she just wants to rest, you know.
I wish more people know that ongoing dialysis demands significant resilience from patients. They go through hours-long treatment and frequent dialysis in a week and follow strict fluid and diet restriction, but they still strive to live a normal life. It's not just physically exhausting, also it's emotional draining too.
Okay, so I would like to thank my mother for being like such a wonderful nurse manager and such a wonderful nurse to her colleagues and to her patients. And thank you for trying her best to raise me up. And you raised me well.
If you know anyone that has kidney failure, it's actually quite challenging for them to deal with lifestyle and mental challenges alone. We should do our best to support them in everywhere that we can and provide them the best quality of care for them to live life meaningfully.